Welcome to the podcast, How to Be Well and Strong. I'm your host, Jacqueline Genova, and I'm excited to have you join me as I speak with some of the leading figures in the fields of wellness, integrative medicine, and mental health, as we discover what it truly means to be well and strong in both body and mind. Get ready to be empowered, inspired, and motivated about being an advocate for your own health. Welcome to today's episode on the How to Be Well and Strong podcast. I have the wonderful pleasure of speaking with our guest today, Ivelisse Page, an incredible and inspirational woman who has truly been a pioneer in advocating for the use of complementary therapies for cancer patients. Ivelisse is the executive director and co-founder of Believe Big, that helps cancer patients face, fight, and overcome cancer. Diagnosed with stage 4 colon cancer in 2008, she overcame the 8% 2-year survivorship rate without the use of chemotherapy and remains cancer-free today. Since 2011, she's helped thousands of patients move through the overwhelming process of cancer by bridging the gap between conventional and complementary medicine. Believe Big not only helps patients survive, but thrive, not just physically, but emotionally and spiritually as well. Ivelisse, thank you so much for joining today. This is very special for me because everything you do is so close to my heart, my mission with Well and Strong, and what I've personally been going through with my mom. So thank you for all of the wonderful work that you do, for who you are as a person. And I am so excited to share just a small part of that today with everyone.
Oh, Jacqueline, thanks for having me. You are just such a pleasure to speak with and to know, and I'm honored to actually be on your show today. So thank you.
Well, I was telling you earlier, thanks to you, because Believe Big was the first podcast that I had actually done. So you truly gave me the encouragement and the push I needed to venture into this space. So I owe it to you.
Well, you nailed it. Everyone loved that episode. And so this is like your wheelhouse. So I'm excited that you're starting this podcast for sure.
Thank you. And I'll link that episode in the show too for listeners. It was a great one on Slate. I would just like to start by having you share your personal story with cancer and how that led to your discovery of mistletoe therapy.
Yeah. So Jacqueline, I still remember the day I was diagnosed, and it was in 2008. I was lying in the bed at the surgery center when my doctor walked in, and I could just tell by the look on his face that something was wrong. And he told me what no patient wants to hear, no person wants to hear, and it's, we found cancer. And at that moment, Jacqueline, I honestly started to cry and I couldn't stop. And I was filled with fear, not seeing my 4 kids grow up or growing old with my husband, Jimmy. And amazingly, at that very moment, I flashed back to when I was 13 and I lost my father to cancer. And it was so ironic to me because I had spent my entire life trying to avoid this. And here I was diagnosed at the very same age with the very same type of cancer that took his life, my grandmother's life, and half of her siblings. And it seemed so hopeless at the time. And I was only 37.
Based on that, what was the deciding factor that made you choose to opt for mistletoe instead of chemo?
Yeah. So, at that moment, once we had all of the testing in and all the questions that I asked the oncologist and, visited 3 different hospitals with 3 different oncologists and to really find out who was going to be the best one to monitor me. And actually, they all had the same odds of survival for stage 4. And that's a less than 8% chance of surviving 2 years. And so for me, I just felt like I was going to burn down a whole forest for one rotten tree. I felt like if I had 6 months to live, I'm going to live it out with my family. I am going to enjoy the moments that I have left with my kids and Jimmy. And everyone has to make that own decision for themselves. But for me, the risks did not outweigh the benefit of doing those traditional treatments. So I did do surgeries, and I did that part of the conventional, and I was monitored by my oncologist. But during that time, we met with an amazing physician that told us about mistletoe therapy. And who would have thought that the mistletoe plant you see at Christmas was used around the world to treat cancer? And, he gave us a handout at the very first meeting and had all the clinical studies on mistletoe, all the different benefits of it. And for some of your listeners that may not be aware of what mistletoe does, it's been widely used in Europe for malignant and non-malignant tumors for over a century now. It's used for the stimulation of bone marrow activity. It can be used alongside of conventional treatments to offset the negative side effects of chemotherapy and radiation. It diminishes tumor-related pain, and it can help prevent recurrence. But furthermore, my doctor also told me that it would make me feel better. It would reduce my pain, and it would give me more energy and a better outlook at life. And I was so amazed. And then my next question to him was, well, what are the side effects? Because with every medication, there is
Right.
side effects. And amazingly, a few rare cases of a headaches or fever, there weren't any. And so in my mind, I felt like I had everything to gain and nothing to lose. So that day in his office, I actually had my first injection of mistletoe that I believe changed the trajectory of my life.
Wow, that's incredible. And going back to your story earlier, I mean, I obviously have heard you featured on several different podcasts, and I couldn't imagine what that was like, especially what your dad went through. And I think something really important, and you obviously can attest to this better than I can, is that God permits these things in our lives because he has a better plan. And even though we don't see it or understand it now, his thoughts are higher than our thoughts. I think the beauty in that is you have done so much for so many people, and he allowed you to experience that time frame of fear to accomplish what he wanted to accomplish through you. So I just wanted to say that as well. But also with your dad, I'm assuming that your mom, and you were young, 13, you weren't familiar at all with the field of complementary medicine and any of that.
No, I wasn't. And, interestingly enough, for my mom, it brought even more fear to her because my dad had looked into different therapies, and he did not do the traditional treatments as well. He didn't go through the follow-up care that he should have. And I think that's why his cancer came back with a vengeance and he passed on 2 years later. But he did like a microbiotic diet, and he was into selenium and so many other supplements. So he did not do the conventional either outside of surgery. So my mom was really concerned that I wasn't going to do it. And but then when I told her all that we had researched and everything that we had done, she felt more at peace about it, and she was 100% supportive of what my thoughts on how I wanted to proceed forward. And interestingly enough, years later, she told me, Ivelisse, your dad had found this therapy in Germany that he wanted to pursue. And she goes, I think it was mistletoe therapy all those years ago. And she goes, I am so upset because we would have had to move to Germany for him to get this. And you guys were all so little, and we just couldn't move our whole family there. And so she goes, I just, it's amazed that fast forward and that God put it in front of you, and two people from two different walks of life within the same week told you to speak to this doctor and who told you about mistletoe. And she goes, and I just am kicking myself because, man, if we would have gone to Germany, what if? And I just told her, I said, you know what, we can never look back. Hindsight is always 20/20. And like you said, God has his purposes, and he is faithful, and he never wastes our pain. And for my dad, actually, there's a saying that says, though not everyone will be cured, everyone can heal. And my dad healed. And it wasn't in the physical sense that everyone thought he would or wanted him to. We believed he would. It was in the spiritual side that brought my whole family to faith. And it gave us an infusion, and me personally, once I was diagnosed, to be able to handle the fear and the anxiety that was in my journey ahead. So
I love that. Amen to that. And that's something I've been struggling with, but I feel like I'm at a better place now as hindsight is 20/20. And I certainly would have made different decisions in my mom's care, but we learn from the experience and we help others, and we trust that God works everything for good. I really love that. But one thing I did want to touch on for listeners, so you and I are already diving into complementary medicine and all these different treatments. Mistletoe is obviously one form of complementary medicine in the holistic cancer space. I just wanted to kind of clarify for the audience the difference between a conventional and holistic approach to treating cancer. And I like to use the analogy of mold growing in a basement. We could think of mold as the cancer and the basement as our bodies or internal environment. And a conventional approach would be, let's destroy the mold with bleach, which in this case would be chemo. What happens is, sure, the bleach would most likely get rid of the mold right away, but the mold will ultimately come back. And when it does come back, it'll be more aggressive. So a holistic approach first asks the question, what caused the mold to grow in the first place? What were the conditions of the environment? Do we need to perhaps maybe put a dehumidifier in here so that we can change the environment so that it can't grow in the first place? I like to use that analogy when explaining those different paradigms for patients, but is there anything else you'd like to include in, I guess, assessing those different lenses by which people treat cancer today?
Yes. And I think that a lot of people don't realize that for conventional oncology, I think you need to have a treatment team. So not just an integrative doctor and not just a conventional oncologist or a surgeon. You need to have a team approach with everyone who knows their specialty. And what a lot of people don't realize, Jacqueline, is that with conventional oncologists can only recommend chemotherapy, radiation, and surgery. That's it. They're not able to offer anything that's outside of standard of care because of liability reasons and things like that. And that's why the Mistletoe clinical trial that we are working through the phases with Johns Hopkins University is so vital, because we need that trial to be done here in the United States so that it can be offered as standard of care and it can be even covered by insurance. So it's that process. That's one thing that a lot of people don't realize.
And congratulations on that too. For listeners, Believe Big funded research that showed mistletoe not only to be safe, but also beneficial to quality of life. And this was an incredible win, I'm sure, not only for Believe Big, but also for people like me, in that it shows hope and promise that complementary therapies can in fact be brought to clinical trial stage. And my mom and I were just chatting about this the other day, and she was just saying how sad it is that insurance won't cover treatments like hyperthermia or hyperbaric oxygen or mistletoe because they haven't been, quote unquote, proven or met the standard to be effective treatments for cancer. Yet the irony is that they're more effective and, as you mentioned earlier, less toxic than most of the conventional treatments available right now.
Yeah. And I think that there's so many tools in the toolbox, and you talk about that all the time, right? So many different tools. And I think that people have to do the research for themselves and know what is going to be best for them as an individual. And that's when the integrative physicians that specialize in oncology come and, like your mold analogy, and say, well, for your specific mold, these are the things that are going to be most effective for you. And sometimes for some patients, it may be chemo and radiation but they add in certain things so that it is less toxic for them, or they tell them to fast so that it's able to get out. The treatment works better, and then helping them detox from that. So it's just so many ways that a person can approach it. But the most important thing to remember is that you need to remember that your care needs to be individualized and not standardized. And that's what's done today, typically.
I love that. I know. And even too, there's things people can implement. If someone is going through chemotherapy, include fasting, like you said, because there's been so much literature on how fasting can make the chemo better able to target the cancer cells and mitigate the side effects that you might experience. So I'm all about an integrative approach. I wrote a thesis about that very topic, is including integrative medicine in our healthcare system, specifically for cancer patients. So that's been really key cornerstone content for Well and Strong. And another thing I'd like to address is the mechanisms by which mistletoe works. My understanding, and you're obviously expert in this, is that it activates our body's immune system. So it's like the natural form of immunotherapy that is still under clinical trial right now and probably years to come. So could you explain a bit more on the mechanisms by which it works?
Yeah. So mistletoe has so many different substances. Two of the big ones are lectins and viscotoxins. And for layman's terms, viscotoxins, they say it's the same potency of a venom of a viper. I mean, I was like, whoa.
Wow.
And what that does is that it helps to break down the cancer cell wall. So it helps create what they call apoptosis or cell death. And then the lectins that are in the mistletoe, those properties help to modulate your immune system, to help your quality of life factor. And that's another factor that a lot of people don't realize with mistletoe. There's so many different properties in there, also based on the type of tree that it's grown on. So there's mistletoe grown on an oak tree, an ash tree, an apple tree, a pine tree. And depending on the type of cancer you have will determine the type of mistletoe they give you, because they each are slightly different in the items that are inside of that particular mistletoe. So it does so much, not only to extend the quantity of life, but also the quality of life for patients.
I was reading that in the Mistletoe book, Mistletoe and the Emerging Future of Integrative Oncology, which, as you know, is written by very prominent figures. Dr. Peter, Dr. Nisha Winters also co-authored it. Fascinating book. Highly recommend it to listeners. I'll include it in the show notes. But I was just parsing through that chapter about, just like you said, selecting the right tree for the right type of cancer, and blew my mind. Truly, it blew my mind. And my understanding too, and my mom's been doing subcutaneous mistletoe injections, but what is the difference between sub-Q and IV in terms of efficacy? Is one better than the other?
That's kind of what they're determining now. The IV was not available to me when I was going through cancer 14 years ago here in the US. It was just the injections. And that worked great for me. The IV seems to be used more by the physicians today, especially someone in the later stages that need a little more support to slow things down and to stabilize a patient. And then they can continue on with the injections. But over the course of years and time, I feel like they're both have their roles, but they're both just as effective. It just depends on how the practitioner will decide to use it best for the patient. I personally prefer the injections only because of the cost effectiveness of it. So one mistletoe IV infusion can be $400 to $800. And you may need that once a week, right? Versus the injections are about $200 a month. And so it's a huge factor when you're trying to determine everything's out of pocket when it comes to complementary medicine. You're weighing what you need to do and what therapies are going to be best and what you can afford. And so I love the sub-Q because it is affordable to most people.
Yeah, I love that. And is this a therapy that is done indefinitely? And at the time of your diagnosis, how long were you including it in your regimen before you got a clear scan back?
Yeah, so I started on my mistletoe injections 2 weeks before my liver surgery. So I had a colon resection, and then 2 months later, I had to have a liver resection. We realized it was in my liver. And 2 weeks beforehand, I started on the mistletoe injections. And then I paused while I was in the hospital. And then I started back up as soon as I got home. 10 weeks later, which is when I went up for my follow-up appointment, my oncologist said that typically in the scan, 75% of the time, the cancer's back. And I could not believe that 10 weeks later.
Wow.
And I remember my husband looked at me and he said, Ivelisse, you're going to be that 25%. And I'm like, oh, thank God for your positivity. Thank God for your belief. And I'm like, you're right. I am going to be that 25. And as we're sitting in his office, my scans came through and there was no evidence of disease at the 10-week mark. And then 3 months later, no evidence of disease. 3 months after that, no evidence of the disease. And then every year after, and up to like 5 years, and then they released me as a patient. But I, at that point, could have decided to go off the mistletoe. But what most practitioners who do with mistletoe, there isn't a standard to say, okay, after this point, you're done. You don't continue anymore. Some people choose to. They give us the choice, which I think is beautiful. You kind of see what your body needs. And for me, I've gone off of it for a period of time and I didn't feel as good. And for me, the cost of it, it's not going to hurt me. It can only help me. And I felt like I had, again, more to gain than to lose by not continuing. And I'm just on a maintenance dose now. Some individuals will do a series once a year. I just do a maintenance dose twice a week. And and it's affordable. So it's not something that I've decided to stop. And it's been 14 years because it prevents the recurrence as well. It has those properties in there. And especially with myself, they say people who have later stage cancers or aggressive genetic forms like I did, they would encourage you to continue on as well.
Right. Interesting. And to that point too, I think it was on one of the Believe Big podcasts where you had said that your husband, Jimmy, actually wanted to start doing mistletoe too because he heard about the wonderful benefits of it. I was cracking up. But he has a good point, right? If it can only help activate our immune systems and not harm us, should everyone be doing mistletoe?
I wish that would be the case, but it's almost like, you wouldn't take extra vitamin D unless you were depleted in it, or that if your levels weren't what they needed. So it's similar to mistletoe. You don't want to use it until you need it. You want that tool to be ready to go, because over the course of the years that I've been on it, I've had to increase the dosage because the reaction stops after your body gets used to it. And so then you have to increase the dosage over the years. And so I have always told patients, yeah, that would be awesome. But what they've realized is that you don't want to give your body something that it won't hurt you, of course, but you want to make sure you have that tool should the time come, or if you ever get diagnosed, that it works exactly how it needs to work and at the strength it needs to when you need it.
Yeah, no, that's a great approach. And I'm just curious what your maintenance dose is, because my mom started off with 3, then she jumped to 5. But once we hit 10, there was a massive reaction that lasted about 3 weeks or so. So now she's been doing 5, but I'll hear stories of people doing 100 or upwards of that. I mean, I'm sure it varies across patients, but is there an average dosage that people do, or no?
No, and that's why I really, I typically don't share dosages and what I'm on, because I don't want people to falsely think, oh, I'm just going to find a way to order that and take that, because that's what Ivelisse used, or that's what Jacqueline's mom used. But because it is such an individualized medicine, it's not like a supplement that you can just take. It really has to be through a physician that is trained and knows all the different forms, all the different types of cancers, how it affects the person's body, because it is individualized. And over the course of the years, I can tell you this, I started on a low dose like your mom, and then I got up to 50, and then I had to increase again. And then I switched the type of mistletoe. My doctor switched it probably about 2-3 years ago. And now I'm getting a reaction with a lower dose of a different type. So there's so many nuances to it that it's not something that you can self-prescribe. It really has to be done by a physician that's trained.
That makes sense. Also, too, I've heard varying opinions on this. And again, just curious of your thoughts. Can mistletoe, I mean, we know that it can be used in conjunction with conventional treatments. But then I've also heard other practitioners say, for example, if you're going to choose one route, go that route. Someone I recently spoke with said that he wouldn't do chemo and mistletoe. He would do one or the other. He's like, they don't work synergistically. What are your thoughts on that?
A patient said that, or a doctor?
A doctor.
Huh, interesting. It might have been for a particular person's case, but all the research that's been done in Germany and overseas, and again, that might have been for a particular circumstance or a particular case, because sometimes when people are going through bone marrow transplants and things like that, they don't want anything added in addition to that treatment, just because they want to make sure that is the first thing that needs to be done. And also with blood cancers, it can be a little different too. So, but in general, in Germany and in Europe, it's used alongside conventional treatments. And the best part about it, which I share with oncologists, is that it won't counteract what they're trying to do. Unlike some herbs that they'll tell you, don't take this herb while you're going through chemo, because they're trying to shut your body down. And then these herbs are trying to rev it up, and it can counteract the treatment that they're trying to do. Mistletoe will not do that. And so it's been used again for over 100 years. It's not something new. What I have been told is that you don't want to do IV mistletoe or the injections of mistletoe the same day that you do IV vitamin C. And so those are done on different days or several hours past the time that you do one or the other, so that, again, it's not, your body's not fighting each other. The mistletoe warms the body and the IV vitamin C cools the body. So you want one or the other to be done and not work against each other.
That's great. And that's majority of what I've read as well. What advice do you have for cancer patients who are working with conventional oncologists who are interested in pursuing these complementary therapies, but feel perhaps like frightened by the response they might get from their oncologist? What tips do you have for them?
Yeah, I would definitely say that you need to be your best advocate. Yes, we need to listen to the wisdom of our doctors to hear what they have to say, as they are trained in an area of specialty that we're not. But then they also need to listen to us, because we're trained best in how our body responds to things and what is best for ourselves. And so we at Believe Big really encourage patients to interview 3 different oncologists from 3 different hospitals. And we have a questionnaire that they ask. And you can tell, by the way they answer their questions, whether they're going to be an oncologist that is my way or the highway, or yes, you know what, I'm going to work with you, and I'm open to your natural approach. You want someone who's going to be humble enough to listen to you. And I was grateful to have that. And they are out there. You just have to find them. And so that would be my best advice: is your body best. You know what you respond to best. Yes, listen to their wisdom, but you need to evaluate all that you know and decide for yourself what is going to be best for you.
I couldn't agree more. And I'm so glad you highlighted that. I went through that resource on Believe Big, 10 questions to ask your oncologist, and they were spot on. Wish I had this years ago, but it's a wonderful resource. I'll include it in the show notes as well. If you could give one piece of advice to someone on their cancer journey, what would it be?
I would say is never give up hope. And I would say that, we look at the challenge before us many times, but what I try to do is to lay that aside and realize that we serve a great God. We serve a big God, and He's able to do above and beyond what we could ever imagine, ask, or imagine. And so I really feel like if we focus on the capability of God instead of the challenge of cancer, we have more peace. We are able to walk with more confidence. And then our body also responds, because it's not in a fight or flight mode. It's in a rest and repair mode. And so the mind, the emotions play a huge role in your healing. This world is so focused on the physical side of healing, but the emotional, the mental, and the spiritual side of your healing is equally as important. So doing those small things each day, just remembering who you are, remembering the capabilities of God, and having your emotions and your mind strong is going to help you heal tremendously.
I love that. And you and I chatted briefly about that in our first podcast episode on Believe Big, but I'm a huge affirmations person. And I tell my mom every morning, you wake up, you say those biblical affirmations, and your day is off to a good start. I think sadly today, patients identify themselves with their diagnosis. I have this, or I am this. And that's the worst thing to do. Sadly, in their conventional system, you're labeled. Never label yourself with anything, whether it's stage 4 or stage 1. You're not your diagnosis. The body can heal itself. It's just a matter of creating that right environment. So I love that. I'm very glad you touched on that. Thank you so much again, just for all of this wisdom. I have, again, so many resources I'm going to be sharing in the show notes with my audience. But I do look forward to doing another series with you, because there's so many topics I'd still love to pick your brain on.
Absolutely. Anytime.
My last question for you, Ivelisse, what does being well and strong mean to you?
We touched on it just, in the previous question, and being well and strong to me means being well in mind and body and spirit. And so, doing things each day, whether you don't have cancer or you have cancer, is, one of the benefits of being someone who doesn't have cancer is that you can make slow changes every day towards better health, towards being well and strong. You can make that 2-degree shift in whatever area that is, whether it's reducing my toxic load by changing my cleaning products, or working on sleeping better, or physical exercise or prayer. You can make small changes every day in order to get you to be well and strong. For cancer patients, you have to many times make a 180. But like you mentioned earlier, is you can be well and strong while going through something difficult like cancer. We know of hundreds and thousands of patients that have, and you can too.
I love that. And also too, this just came to me, but I read this. I don't know if it was in a devotional, maybe Chris Warwick's Beat Cancer Daily devotional, but it was something to the effect of God will permit or allow a situation in your life that may cause you suffering to bring you closer to him. And that's also brought me a lot of peace because just like you said, he doesn't waste pain. So he doesn't waste suffering either. And if that's an avenue for you to develop your relationship closer with him as you've experienced, then nothing's a lost cause. And it's all about perspective.
Yeah, I mean, it's that saying that a lot of people hear is God won't give you anything you can't handle. And I don't think that's fully true. I believe that he sometimes does allow things so that you depend more on him. So you realize the value of compassion with other people. So you value the importance of community in your life and that we need each other and that we're not alone. So I feel like in these moments of trial and testing becomes an incredible testimony to his goodness.
I agree. Ivelisse, where can listeners find you? So I know we touched on Believe Big and the website, but are there any other specific social channels that we can share?
Yeah. So, people can go to believebig.org/podcast, and they can also listen to me each week as far as we interview other individuals like yourself. And so, I'm on Instagram and on Facebook as well through Believe Big. So if people would like to connect, you can do so there.
Wonderful. And again, highly recommend Believe Big podcast. I listen every single week. It's one of my favorites. I got my mom to download the Apple Podcast app just so she could listen to Believe Big. So we are number one fans.
Aw, you're so sweet. So kind.
Well, Ivelisse, thank you so much. This has truly been a pleasure, and I look forward to having you back on soon.
Well, thank you, Jacqueline, for having me. It's been a pleasure.
I hope you enjoyed this episode. If you would like to support the show, please subscribe, leave a rating, and share it with others. Be sure to visit wellandstrong.com to access notes from the show and to stay current with new content. I'm so grateful you joined me. Be well and be strong.